I said that we found that renal failure is the major killer in our population. Of course, this paper included both type 1 and type 2 diabetes. And a similar study was done after 10 years, in 2009. In 10 years, we did not see any difference. It was same, infection, number one, followed by renal failure. And particularly in type 1 diabetes, we saw that our type 1 diabetics are dying of complications before their 30. They don't celebrate their 30th birthday, which is worrisome. Here I want to mention that in India we have a national registry which is called as Young Diabetes Registry, which is an initiative from Indian Council of Medical Research. They have plenty of centers. Our center is also one of them. So we already have a diabetes registry from last 4 years. So far we have registered around 500 plus cases of young diabetics. 80% are type 1 diabetes and remaining, and in those 80%, 20% already have developed diabetes-related complications. This is our young diabetes clinic. Why I have shown a picture of a pump? Because out of those 500, only one uses pump. Because it's not affordable. We don't have privilege of insurance and reimbursement in our country. So this is the only rich patient. Only he could afford it. So the hypothesis behind my proposal is that we have observed that many patients in our cohort develop some complications like diabetic nephropathy early, even before retinopathy, possibly due to underlying genetic and other factors peculiar to our population. Because ours is a different population than the rest of the India. It's an ethnic Kashmiri population. So it would be fascinating to assess the predictors of chronic microvascular complications, the two major causes of morbidity and mortality among youth with type 1 diabetes in our cohort. Coming to the objectives, so we want to know the prevalence of these complications, and plus to study the predictors of diabetes-related complications in youth onset diabetes, which is particularly type 1 diabetes. And also the secondary objectives to develop predictive modeling of diabetes complications, risk using deep learning, and develop a context-specific strategy in terms of an intervention through disease education, diabetes education, diet, lifestyle modification, and high-risk group. So the approach would be, as I said, that we already have a cohort, so our patients would be from the cohort, those would be the consent. The study design, as I said, we want to also know the prevalence of our diabetes complications, so this would be a cross-sectional study. And the second objective, which is to develop the context-specific measures, which would be a case control study. So I'm planning to study around 200 subjects, like one group with 100, another group 100. So in one group, it would be like those who have diabetes without complications and those who have already developed complications. So we'll try to understand what are the possible risk factors, and so the methods, the case records of all consulting patients registered in our registry will be studied in detail. Data from the records will be captured using detailed questionnaire covering patient background information, health status, smoking status, chronic disease history, and detailed family history. So we have a trained research staff which will take these details. The information will also be recorded from patients' chart relating to current findings on physical examinations, medication use, and laboratory data. The lab work, the screening would be apart from routine work for glucose, blood glucose, renal and liver function tests, liver parameters would be taken. Glycemic control would be assessed by measuring glycated hemoglobin. Fundus would be examined by using handheld fundus, and the other diabetes-related complications, including nephropathy, would be assessed using standard methods recommended by ISPAD 2018 guidelines. We have already it's in the process. We are asking for the approval from the ethics committee. So the significance of the study will be a timely and accurate diagnosis combined with regular follow-up and maintenance of optimal glycemic and risk factor control by judicious use of available therapies will ensure that these young people enjoy a life fruitful and complication-free life in spite of diabetes. So what am I expecting? Expected outcomes would be pattern of or types of all microvascular complications of diabetes, period prevalence rate of all diabetes complications that occur during the course of study, socio-demographic, clinical, and metabolic determinants of chronic diabetes complications, context-specific strategy to improve diabetes-associated adverse outcomes, and predictive modeling of high-risk groups using machine learning, like artificial intelligence. So we also have a limitations, that is loss to follow-up, which I think is common to all subcontinent Indian subcontinent nations. So, okay, so I want to share a few things that I'm very new to ISPAD. It's just been a year and a half that I joined the ISPAD. So the last year the conference was in India, so I was very fortunate to attend that, and I also presented one of my abstracts there. The data was again from the same cohort. It was on vitamin D levels, and followed by I got an opportunity to attend the joint ESAD ISPAD ISP PG course in Prague. As the Julia said that if you want to be a genius, you have to attend these schools regularly and before the age of 40. So I have some years to. Again, I'm also going to Boston to present my abstract. And at the last, I want to acknowledge my mentor, Professor Sharik. He's the professor of endocrinology, STIMS. Last but not the least, I'm getting married next month, 6th October. I'm giving an open invitation to everybody.